Good afternoon, everybody. I'm David Bayada, the CEO here at Bayada Home Healthcare. Today is Friday, April 9th, and this is your weekly CEO update for the coronavirus pandemic. As always, joined by Nora Triola, and looking forward to jumping right in. A lot going on out there, and I appreciate you tuning in for these key updates every week. I'm going to share some slides, as always, some key information this week about travel, new guidance evolving from the CDC, and want to jump right in and share that. Nora?
Thank you, David. And do have exciting news that was just published April 2nd, which was Friday, for those that are vaccinated. So really important as we think about the role modeling that we do as healthcare professionals and how we follow those safety standards and comply with CDC to make sure that we're keeping all of our employees as well as our vulnerable clients safe during this time of a pandemic. And so when the CDC released these, they really wanted to remind us that those safety strategies that you all have used day in and day out as you go from client home have kept you safe, wearing the mask and making sure that it covers your nose and your mouth and is rather form-fitting or snug to the cheeks, staying away from crowds and 6 foot distance from other individuals, and that attention to using hand sanitizer or washing your hands is of utmost importance as we continue down the journey with that additional good news strategy of being vaccinated. But not everybody that wants to get vaccinated has gotten vaccinated yet. And so, we're sort of in that journey, and we're working hard to make sure that there are vaccination opportunities for each and every one of you, and that those of us that want to get vaccinated can. And the CDC talked on Friday about some opportunities for those individuals who have been vaccinated as it relates to domestic and international travel. And if you remember, there were guidelines prior to vaccines being available that required quarantining and testing for destinations, and you had to pay attention to state and international country guidelines. Some of those obviously are being modified now with the new guidance from CDC, but we still have to check the state and locals. But really the quarantining and the testing for domestic travel for fully vaccinated individuals has been relaxed by the CDC. Now, fully vaccinated is an important concept. That means you receive the final shot. If it's a single shot, your Johnson & Johnson vaccine, 2 weeks after that. Or if it's one of the 2-dose vaccines, Moderna or Pfizer, you receive the second vaccine, and then 2 weeks after that would be when you would technically be called fully vaccinated. If you're fully vaccinated, you do not have to quarantine, you do not have to test before for domestic travel. You return to your state from another state, and you would monitor yourself for symptoms. You would, upon any symptoms developing, report those to the office, isolate, and then would get tested if you needed to. A little different for international travel, the same 2 requirements, but the addition of needing to be tested when you return. And it's that viral test, so that quick test, but 3 to 5 days after you return, we'd need to see the results so that you could come back to work safely, knowing that you hadn't. And the reason they've added that for international travel is really because there are different variants in the different countries, as well as different vaccines that are being used. And so the risk of international travel is higher, quite frankly, than if it was domestic travel that you were planning to do. So some important new guidelines released. We've incorporated those into our policies. We're updating some of the tools. There's a lot of tools around travel, and so they'll be available for you shortly. but wanted to make sure you knew that there was new guidance on travel for those that are vaccinated. And stay tuned. We're working hard to get you spots so that you can get your shot, because the data is so compelling. We've given it to over 100 million across the country, good, safe vaccines, all three of them with high degrees of efficacy. And now you're starting to see the benefits of being vaccinated and how, in fact, that may allow you to move more about your normal activities pre-COVID. So thanks for the opportunity to chat with you today about travel, and as always, grateful for all you do to keep both yourselves and our clients safe every day.
Thanks, Nora. Definitely excited to see vaccine availability continue to build. For myself, I'm finally scheduled for my first shot this weekend, and it's been quite an experience trying to hit refresh on my internet browser as often as I can carve out a little bit of time to get an available slot, and it finally opened up. So looking forward to it. As always, want to close with some images and stories of all the positive energy out there. These are not virtual backgrounds. This is our team in Maui. I've been to this office, and I am always jealous to see the images in the background outside the windows that these teams get to look at every day. But this is their excitement and positive energy after their vaccination experiences. Even when we're sitting in our offices with concrete outside instead of beautiful mountains and Hawaii scenery, I think we all share the same positive feelings and optimism that comes with that vaccination. So congrats to the Maui team, and good luck to all of you in your access to vaccinations over the coming weeks. We'll see you next week.